Hello, I'm Dr. George Lundberg, editor-at-large for MedPage Today. And we are in Chicago, Illinois at the annual meeting of the American Medical Association having conversations with a variety of leaders of American medicine. Dr. Cecil Wilson, seated to my right, is the incoming president, the 165th president of the American Medical Association as of 2 days from now, I believe.
That's correct.
Dr. Wilson is a practicing internist from Winter Park, Florida, where he's lived for about 40 years. And I want to first ask you, after thanking you for coming on with us, how long have you worked in organized medicine?
Well, first, thank you for having me here. And second, I guess it's been ever since I got out of the Navy back in '69 and started practice and said, you know, what can I do in addition to practice to, in essence, give back, to give to the community and be involved? And so that's been the thread which has gone from city to county to state and now to the American Medical Association.
All the usual progressions.
Exactly, all the ladders, that's right.
Okay, a year from today, what do you hope your AMA presidency will have been marked by?
Well, what I hope and expect is that the AMA's progress during that time will be, probably the biggest part of that will be the implementation of a health system reform legislation that has just been enacted in March, at least to get it down that path. So I think that's a big job we're going to have, putting those laws into effect, being sure that the regulations are done in a way that's appropriate, also correcting some deficiencies that are in that legislation, particularly revolving around physician Medicare payment, around medical liability reform, being sure that Medicaid is updated as well. Those are things we're going to have to work on to get in and get improvements. There are also some things in the legislation, the Independent Payment Advisory Board, that we have concerns about that are going to need to be worked on, and some other really positive things related to quality improvement that we think is going to be essential for reform in this country that's going to make a difference.
Physicians speak with many voices. The American Medical Association attempts to be the voice of American medicine, and yet there are many divergent views. I think, again, I joined the American Medical Association in 1968, and membership was a big deal at that time. LACMA, CMA, I was in LA at the time. Not LA, Lower Alabama, LA, Los Angeles at that time. But membership was a big deal, and membership's a big deal now. I think there's turmoil there. How can you, how can we, how can all physicians work together better?
Yeah. Well, let's talk specifically about the health system reform debate that we've been going through this past year. And clearly a lot of physicians have been upset about the course, the direction that has taken. They've been upset a lot about how it's been done, about the sort of the sausage-making aspect of legislation. But I would suggest that they have actually just reflected what we see in the country at large. Everybody's concerned they might lose something they have or get something they don't want. And of course, physicians being right there taking care of patients feel that more acutely. So that's a part of it. And so we've got our job cut out for us.
It's also a complicated message. I mean, if one has a simple message that one can do again and again and again, it becomes part of dogma and part of understanding. But this has been such a complicated process, such a complicated message, and frankly, what you described for me in the regulatory process coming up and the wish for having even legislative changes as we go forward, it remains very complicated.
Absolutely, and that's been one of the realities of health system reform. Some people will say, well, let's just fix insurance, or let's just fix tort reform. And the challenge is the old knee bone connected to the ankle bone. Everything's interrelated. And the challenge has been to say, if you only do one thing and you don't address the other thing, you're going to make things worse. And so we do have a lot of things on our plate. You know, in a way, that is a challenge. It is difficult, but in some ways that makes it very satisfying when you can make that happen, and that's what we plan to do.
Well, it is complicated. Anybody who says it's not complicated just doesn't understand the issues at all. But as you go forward, if our American Medical Association could devise a few simple messages that are absolutely true, right on, and communicate those messages so they're not lost in all the noise that's going on. Some of the noise is not true noise. Some of it is people just trying to make trouble in a variety of ways. Meanwhile, I'm very proud of our American Medical Association. I remain a member since 1968, and I think that the association did us in American medicine proud this last year. And most recently, with the president coming on last Saturday, just yesterday, in support of physician payment and fixing that problem that keeps coming up every year about doctors getting paid properly for Medicare, I think having the president on the same side as the AMA on an issue like this is pretty good.
Well, first, thank you for your membership all those years. And secondly, yes, I can't remember a time in recent past when a president did what the president did yesterday on this particular issue. And first of all, he gets a lot of credit for putting health system reform
Absolutely
on top of his agenda. And now to recognize that unless we can fix this SGR problem, this flawed formula, our senior citizens are at risk. And the TRICARE community, the military families who rely on TRICARE, the same payment there, the baby boomers who are coming online, but also in a bigger sense, a lot of the things related to reform, the quality improvement, the continuity of care, the patient-centered medical home, all of these are dependent on a stable federal program of Medicare. And unless we can stabilize that, we're going to be in a lot of hurt.
No question about it. Well, I want to thank you for taking time out of your very busy schedule to come to talk with me, to talk with us today. I wish you well in your time, and thank you all for watching us today. Talk to Dr. Cecil Wilson, the almost president of the AMA as of 2 days from now. And we wish him well, and we wish you well. Thank you.